Hello again and welcome back to my channel. So today I like to talk about postpartum mood disorders. I want to start off by saying I am not a doctor, I'm not a medical professional. This is just some information I've come across doing my own research and my own personal experience. So the three postpartum disorders I like to talk about today are the baby blues, postpartum anxiety, and postpartum depression. So I have my notes and I'll just go through each one, the signs and symptoms and ways to get treatment. So the baby blues affects most women post-birth. About 70 to 80% of women will experience some form of baby blues. It occurs within the first 2 weeks post-birth. It's defined by periods of sadness due to your fluctuating hormones and restlessness. But the main thing to remember about the baby blues, it is mild and temporary. So it's usually something that's, after you've given birth and the adrenaline's gone and you have to deal with new life, life as a new mother. It's just a sadness that's linked to that and things like that. So it's totally normal. Most women experience some form of the baby blues. Okay, so PPA, which is known as postpartum anxiety, affects about 15% of mothers post-birth. And it's defined by constant worrying that can't be shut off or a loop of fear and stress. It may be linked to a traumatic birth or a traumatic labor or a difficult labor. It's similar to OCD, and people that already suffer from OCD may be at a greater risk of developing postpartum anxiety. And there's currently no screening tool for this disorder. So it's mainly just feeling like really anxious, concerning thoughts about your baby, feeling anxious about being a mother, that kind of thing. And then postpartum depression, which is known as PPD, affects 1 in 5 mothers will experience PPD. The signs and symptoms include anxiety, sadness, anger, irritability, difficulty sleeping, intrusive thoughts, and difficulty bonding with your baby. And then a more severe form of PPD is postpartum psychosis, but I'll go over that in another video, separate video, all on its own. So currently, the Edinburgh Postnatal Depression Scale is the only scale that is used to diagnose a woman with PPD. And you take this survey about 3 times. So you take it the first time after birth, before leaving the hospital. So it's usually in your discharge paper. So like 1 or 2 days after birth, you'll take this at the hospital. And you'll also take it again at your baby's first pediatric appointment. So it probably depends on your provider, but I remember taking it after each child at their first appointment. So that's like about 2 days after you return home, after you're discharged from the hospital. And then you'll take it again at your 6-week OBGYN appointment. They'll have you do this survey before you have your appointment. And so really the main thing that I saw when it came to PPD and PPA is sleep is one of the most helpful remedies. So just making sure that you're getting enough rest. Try to sleep when the baby sleeps. I know that's hard to do with a newborn, extremely hard. But if you have a partner, if you have a good support system, someone that can help out, and maybe take the baby for a few hours while you catch up on some rest. Sleep is super beneficial and it will help you cope and it will reduce your stress levels. So sleeping is definitely a big part. It will help in reducing the risk of you getting PPD or PPA. Speak Up When You're Down is one of the organizations that you see most about PPD. They have a lot of great resources. I'll link some of their resources down below. So that's like a big organization that hospitals work with, and that's for PPD. Also, just get help if you're feeling sad, if you feel like you're feeling overly sad or overly depressed. Don't be ashamed. Help is out there. Parenting is hard. I mean, it's not easy. And the more help you have, the better. Medication is available for PPD and PPA. Even if you're a breastfeeding mom, there is medication that is safe for you to take while you're breastfeeding, which means that it won't cross the barrier between the breast milk and mom. So you can take those medications, very low dosages. Doctors will know what to put you on if you are a breastfeeding mother. And I will include all the links to the resources that I use below. And just remember to be gentle with yourself. Life is different after you have a baby, whether it's your first baby, your second, your third, your fourth. The family dynamics change, and that can bring stress. Every baby is different. Every pregnancy is different. So just keeping that in mind, and being really, really gentle with yourself, forgiving with yourself, and get help if you need it. If you feel like you're struggling in certain areas, there's nothing to be ashamed of. Definitely get help. Ask for help. Tell your doctor if you're feeling, overwhelmed, things like that. And that will really help you along, hopefully, in preventing PPD. And if you do have it, medication. And again, making sure that you get enough rest, because that will help to bring the stress levels down and make the experience or the episodes of PPD not as great. So thank you for watching the video. Hope you enjoyed. Don't forget to comment, like, and subscribe.